The fact is, the product of the Affordable Care Act for people without health insurance is quality health insurance that's affordable. And that product is working. It's really good. And it turns out there's a massive demand for it.
Okay, there's President Obama yesterday saying there's still some quirks in the health exchange website, but that the demand for Obamacare is massive. So what about the supply of doctors? Well, our next guest knows about that. That's the piece of the puzzle that the president has not addressed in public. Dr. Paul Orloff is the president of the New York County Medical Society, joins us live today. Good morning to you.
Good morning.
Well, what do you think?
That sounds like a simple question. Actually, it's rather profound. I think that to say that Obamacare is about providing health care coverage to the uninsured is a little bit like saying that Moby Dick is a book about hunting whales. That it's so much more than that, and
Sure.
its implications against the doctor-patient relationship can be very profound.
Absolutely. In what way?
It redefines how doctors are organized with accountable care organizations. It redefines how doctors are paid. It redefines how Medicare is going to be realigned with the
Sure.
Independent Physician Payment Advisory Board. And most significantly, it even demands that you have computers, which really affects the doctor-patient relationship, because when I'm inputting data, you get my back. We're no longer communicating directly. And that's just a few examples of ways that it can really affect.
You know, and doctor, in the cell job before the Affordable Care Act went through Congress, we were told that if there's a system out there, the demand is going to explode because so many people are going to have health care for the first time and they're going to go to their doctors. But if you have demand, you got to worry about the supply. You're the supply side. You're the doctor. And there are a number of doctors who have so many questions, they're not even sure that they're going to participate. And if there aren't doctors, why have the system to start with?
I think that's truly an excellent point. All the focus has been on exchanges, on signing up on the website, on creating a healthcare demand. No physician I know has been approached directly about participating in the exchanges. And it's not that doctors are saying, no, we don't want to do it, but it's really, tell me more about it. I need to understand the exchange. I have to have an idea what I'm going to be reimbursed. Nobody takes a job without knowing the salary.
Sure.
What's the claims process going to be like? In order to make a logical and important decision like this that can involve so many potential patients, you need information, and there's been none.
You know, I just heard from you something that I had never heard before, that the government or your health and, the insurance companies that you work with or the exchanges have not talked to you, have not talked to doctors and said, okay, are you with us or are you not with us?
At best, they say, are you with us or not with us, without giving you any details, and we can't make a decision.
And what have you
details.
said so far?
They say that they send letters saying, unless you opt out, and opt out of all the insurance, not just the exchange
Medicare, Medicaid,
or the exchange insurance, but all of the insurance, then we're going to imply that you're in. You have to actively opt out. Well, most of us, anybody I spoke with, didn't even see that letter or get an email. So everybody's really caught by surprise right now. And the confusion around it. Last night we had a meeting of the board of directors of the New York County Medical Society. We got a lot of sophisticated people on that board, and it was very clear that none of us really understood what was going on.
And at this point, you still don't know if you're in?
No, I don't. I'm not saying that I am or I'm not. I just need information.
Man, if somebody in Washington is watching, could you please call these guys and gals? Because they need to know. Dr. Paul Orloff, it's really, that's quite an eye-opener. We thank you very much for joining us.
Thank you very much. I appreciate the opportunity.